Face mask is very important to prevent respiratory hygiene, to get a good respiratory hygiene, to prevent respiratory infection, especially coronavirus. We are supposed to use a mask. Now let us see how to wear a mask. Clean your hands before you put your mask on, as well as before and after you take it off and after you touch it any time. Make sure it covers both your face, mouth and chin. When you take off a mask, store it in a clean plastic bag and every day either wash it if it is a fabric mask or dispose a medical mask in trash bin. Don't use mask with valves. If you are using a fabric mask, we are advising to clean it with disinfectant solutions. If we are using medical mask, you have to dispose it, and you are not supposed to use mask with valves. And if you are reusing the mask, if it is a reusable mask and if you are not supposed to wash it, then you have to hang it in sunlight, and you have to cover and keep it in a plastic bag for a week. For example, 1 week we are using Monday, write in each cover Monday, Tuesday, Wednesday, Thursday, in that way, and put one mask in Monday cover, and next Monday you can take the same mask and use it. So in that way also you can use if it is reusable one. Otherwise, if it is disposable one, immediately after use you are supposed, without touching the front part of the mask, you only holding the earpiece, you have to remove it and put it in the trash bin. Mainly we are advising to use N95 mask wherever is needed. You should not miss using the N95 mask wherever is necessary, especially during the crowding place, a place which is more number of people getting together, or if you are going to care patients in the hospitals or suspected of corona, then you are supposed to use N95 mask. And not all masks are the same. N95 is different. What is N95 means? N is a respirator rating letter classes. It stands for N means non-oil, meaning is that if no oil based particulates are present in that manufacturing of that mask, and we can use in any work environment. So you can't get scared. Even there is no need to worry to use this kind of mask in the factories, oil based, or there is a chances of burns, or there will not be any kind of issues because it is not containing any kind of oil burst particulate in it. So it is a non-oil based mask. So that is called as N. N is for respiratory rating, mainly N means non-oil. So any work environment we can use. It is safe to use this N95 mask. You can see the difference. This is homemade mask. You can see the N95 and surgical mask. So wherever necessary, don't forget to use N95 mask. Okay, coming to the surface cleaning. The surface viruses, coronaviruses on surface die within hours to days. So coronavirus die faster when it is exposed to sunlight and warm temperature. So in that way, always see that the dress and the environment articles what you are using, always keep it in a sunlight or warm temperature to prevent it corona free. The surfaces may be contaminated with a number of solutions. So always the common surfaces has to be cleaned with disinfectant solutions. That is, we can use 62 to 71% of ethanol, 50 to 100% of isopropanol, 0.1% of sodium hypochlorite, 0.5% hydrogen peroxide, 0.2 to 7.5% of providine. So these are the various disinfectant which can be used for cleaning of the common surface that can be contaminated, to prevent it decontaminated or disinfectant free, corona free. You can use this. So main surfaces are like in the office tables, bathrooms, common areas, shared electronic equipments like tablets, touch screens, keyboards, remote controls, ATM machines. So all these can be disinfected with these solutions frequently so that you can prevent the infection spread. Healthy diet and lifestyle. So, coronavirus or COVID-19 has made the maintenance of one's immune system more important than ever. So, now we are more aware about the enhancing our immune system or boost up our immune system to prevent the infection getting acquired. So, before any kind of epidemic happened or endemic happened, we are not much bothered about enhancing or boosting our immune system. So, it was not that much danger. But here comes a COVID-19 which made ourselves, it act as an eye-opener to make ourselves healthy with a good immune system. For that, we must have a good healthy diet, being physically active, managing psychological stress and getting enough sleep. So before you go out, what all you must do? You must not forget to take a mask, tissues, hand sanitizer and disinfection wipes. So common surfaces can be cleaned with disinfection wipes before touching. See that always use hand sanitizer and tissues for cleaning your hands and keep it dry and clean always. See that don't forget to use the mask. And when you go out, you have to make the environment safe to use. That is 3 C's you have to avoid. That is spaces that are closed, crowded, involve close contact. So these all things you have to keep in mind. That is outbreaks are mainly reported in restaurants, choir practices, fitness classes, nightclubs, offices and places of worship. So where the people have gathered and often crowded in indoor settings, especially talk louder, shout, breathe heavily or sing, in those areas the epidemic or outbreak is more. So always you have to remember to avoid these places and these situations. The risk of getting COVID-19 are higher in overcrowded, inadequately ventilated spaces, where the infected people spend long periods of time together in close proximity. So these environments are where the viruses appears to spread by respiratory droplets or aerosols more efficiently. So take precautions and it is very important to do that. Next, coming to the COVID-19 vaccine. So we are using, WHO is working in collaboration with scientists and Global Health Organization to speed up the pandemic response. Thereby we come across a discovery of COVAX which will facilitate equitable access and distribution of these vaccines to protect people in all countries. Especially we are prioritizing most risk peoples to be vaccinated first. So as national health regulatory authorities have approved 5 vaccines for public use. So these are the vaccines, that is Tocilizumab by Pfizer and BioNTech, BBIP, CoreV from Sinopharm, CoronaVac from Sinovac, mRNA 1237 from Moderna, COVID-Vac from Gamaleya Research Institute. Pfizer, Moderna and AstraZeneca predicted a manufacturing capacity of 5.3 million doses in 2021, which could be used to vaccinate about 3 million people. So as the vaccines require 2 doses for protective effects against COVID-19. So anyhow, by 2021 onwards, we all will get vaccinated with any of these vaccines and we will be corona free. Hope we all will get protected from this major pandemic. Now let us see if this prevention always you have to keep in mind. And once if you are acquired with the disease, the treatment options are antiviral or retroviral medicines, breathing support like mechanical ventilation, steroids to reduce lung swelling, blood plasma transfusions and non-pharmacological interventions. So any of these are being done, like supportive therapies, fluid therapies, oxygen support, dexamethasone is an option for hospitalized patients or symptomatic treatment. That's how the COVID-19 is being treated. Now let us see the most important part. You are all coming back to the college, right? So what are things you have to keep in mind? So that we'll see in the next slide.